Hello everyone, my name is Victoria and today our team will be covering malaria and the role of public health in preventing and managing outbreaks. We would like to acknowledge the traditional custodians of the lands we're all dialing in from today. With many of us being in Australia, we would also like to pay our respects to Aboriginal and Torres Strait Islander elders, past, present and emerging, for they hold the traditions, histories and hopes of the longest living culture in the world. So what is malaria and where do most cases occur? Malaria is a vector-borne disease caused by parasites that are primarily spread through the bite of the female Anopheles mosquito, a species that's found in tropical and subtropical areas. As you can see from the diagram here, the cycle of disease can be explained by an infected mosquito biting someone. The parasites then spread through the blood cells, ready for another mosquito to bite that person and become a host for the disease to further spread. Malaria has an incubation period of 7 to 30 days after being bitten, and when symptoms arise, they present as a febrile illness. If the disease goes untreated and becomes severe, it results in life-threatening physiological changes, including brain damage, organ failure, and/or blood disorders, all of which can lead to death. The good news is that malaria is curable if diagnosed and treated both early and efficiently. This map is taken from the World Health Organization's World Malaria Report 2019. As you can see, the spread of disease trends towards tropical climates. The countries highlighted in red are those in which Indigenous cases were recorded in 2018, and white indicating countries that have eradicated malaria prior to 2000. Finally, on this slide you can see the estimated number of malaria cases per region. 93% of cases occurred in Africa with an estimated total of 213 million. The next most prevalent region only recorded 7.9 million. For this reason, our data will focus on public health approaches in the African region. Over to you, Simone.
Thank you, Victoria. We will now consider who is most impacted by malaria and why. Pregnant women and children under the age of 5 are the most impacted by malaria. In 2018, 11 million pregnant women in the African region were infected. The main reason for this is that pregnancy decreases immunity and increases susceptibility of infection. Shortly, we will also consider gendered relations that can have an impact. Inequities also exist among pregnant women. Women under the age of 20 and poorer, uneducated rural women are at greater risk and are less likely to receive treatment, as demonstrated. Gendered constructions that make women and children more susceptible to malaria include women's household responsibilities, such as cooking the evening meal outdoors, women needing to seek permission from their husband prior to accessing treatment, and care responsibilities that may limit time and ability to access health care. In terms of children under the age of 5, in 2018 they accounted for 67% of all deaths from malaria globally. Again, lack of immunity is the primary reason for increased risk. However, infection of pregnant women can lead to premature birth and low birth weight newborns, which is a major contributor to infant mortality rates. This graph demonstrates the disparity in death from malaria by age and reiterates the impact malaria has on children under the age of 5 across the world. At a population level, malaria overwhelmingly impacts the poor and vulnerable, and the cost of treatment traps families in a cycle of illness and poverty, therefore limiting opportunity for health and economic development. The following factors contribute to malaria. Poor infrastructure, such as poor housing conditions that provide inadequate protection against mosquitoes, weak health systems that limit access to health care, water development projects such as dams, irrigation and ponds. Although these are beneficial for agricultural development, they can create breeding grounds for mosquitoes. Rapid urbanisation on the outskirts of cities can exacerbate the spread of malaria with construction, overcrowding and poor sanitation. And migration. This may be people without immunity moving to agricultural areas for work and becoming infected, or migration due to civil unrest and natural disasters, which can reintroduce malaria to areas where it was previously reduced or eradicated. These factors need to be considered in malaria treatment and prevention strategies, which Moroniki will explore now.
Thank you, Simone. We will now talk about public health strategies. So the main strategy for malaria prevention, control, and elimination is the new strategy, an all-in-one strategy called the GTS, the Global Technical Strategy, which was ratified by the WHO in 2015, and it provides like an umbrella. It's like an umbrella. It provides a framework for other sub-interventions and sub-strategies to be hinged onto. The first pillar, it has three pillars. The first pillar is to ensure universal health to malaria prevention, diagnosis, and treatment through the vector control. The second pillar is to accelerate efforts towards elimination and attainment of malaria-free statuses. And then the third is to transform malaria surveillance into a core intervention. Some of these sub-strategies are stratification of national maps of malaria distribution, that is in receptive and non-receptive areas. Also to have optimum coverage of insecticide-treated nets and long-lasting treated nets in malaria endemic places. Also, thirdly, to have vector interventions such as the insecticide treated nets that I mentioned and the indoor rapid spraying, the aerosol cans that we know that have the anti-malaria medications in them. Also, lava source treatment is a supplementary strategy in this under this intervention, and also we have the optimizing of case controls and case management. For the weaker strategies, we have that the vector core interventions are where the issues are, and this is because of two main reasons. First is the vector resistance to insecticides, and we have also the parasitic resistance to anti-malaria. Just as you have antibiotic resistance, we have parasitic resistance, and these are the issues that are causing the slow effective rate for malaria eradication. The emerging trend for malaria control will be the malaria vaccine, the RTS AS01, which is in its third trial clinical phase and has been tested in 7 African countries. Thank you.
Thank you, Monique. Now that we understand the overview, data, and strategies, let's look at the recommendations that key decision makers need to consider to reduce the negative impact of malaria. These recommendations can be anchored in three key elements: political will and commitment, strategic information and better guidance, and community involvement. Number one, political will and commitment. Governments that are hardest hit are to take ownership of the challenge of malaria as a public health concern. Politicians and leaders need to commit to malaria elimination. That commitment needs to be actioned in the form of resources, especially funding and legislation, to drive research and grassroots initiatives. Legislation changes need to be implemented to streamline national and regional regulatory processes, which leads into strategic information and better guidance. That streamlining will avoid a delay in the uptake of new evidence based strategies, therefore improving a flow of communication. Research allows for quality data to implement or optimize current efforts towards vector control and a vaccine. Improved malaria surveillance will allow for early testing, therefore early detection and prompt treatment to manage potential outbreaks, especially with the increased travellers, migrants, and refugees who have little to no malaria immunity, and particularly as climate change will be a factor. 3. Community involvement. It is recommended to have community-based workshops and interventions that have been proven to increase uptake of national recommendations. Community members understand social, cultural, and behavioral factors, therefore can highlight strengths and limitations on resource implementation. Noticeably, in the data, and as mentioned by my colleague, women and children are hardest hit, and this is a reflection on some cultural elements, further highlighting the importance of community involvement. A recommendation to assist with this is to change public policies, since they have a definitive and important role in promoting gender inclusive growth and poverty reduction. A recommendation to further increase reach is to have point of care community workers, allowing for equity in access to services, especially for the most vulnerable and hard to reach populations, like pregnant women, as part of antenatal care and screening for children, especially those aged under 5 years old. In conclusion, all these strategies and recommendations will assist with preventing and managing an outbreak of malaria, especially since they have a flow-on effect to outcomes and the real and potential impact it has on determinants of health. Thank you all for listening, and we will now pass the time to you for any questions.